Hi guys, welcome back to my channel. So today in this video, I would like to read an article entitled Shopping for ACA Health Insurance. Here's what's new this year. It's fall again, meaning shorter days, cooler temperatures, and open enrollment for Affordable Care Act marketplace insurance. Sign up begin this week for coverage that starts January 1, 2023, even though much of the ACA coverage stays the same from year to year. There have been a few changes you will want to take note of this fall, including those that might help you even if you don't usually buy ACA insurance but have been paying trouble finding an affordable health plan through your employer. In the past year, the Biden administrations and Congress have taken steps, mainly related to premiums and subsidies, that will affect 2023 coverage and could reduce your costs. Meanwhile, recent court decisions have triggered questions about what sorts of preventive care or abortion services each plan covers. So what's new and what should you know if you are shopping for a health plan? Here are 6 things to keep in mind. First, sign up soon. Open enrollment for people who buy ACA health insurance via healthcare.gov or one on the state exchange begins today, Tuesday, November 1, and in most states lasts through January 2015 to get coverage that begins January 1. Enrollment usually must occur by December 2015. By December 15. 2. Your family might now qualify for a subsidy. One big change is that some families who were barred in past years from getting federal subsidies to help them purchase ACA coverage may now qualify. Applying for health insurance doesn't have to be confusing. Here is a handy glossary. Life Kit. Applying for health insurance doesn't have to be confusing. Here is a handy glossary. A rule recently finalized by the Treasury Department aims to address what has long been termed the family glitch. The change expands the number of families with job-based insurance who can choose to forego their coverage at work and qualify for subsidies to get an ACA plan instead. The White House estimates that this adjustment could help about 1 million people gain coverage or get more affordable insurance. Before, employees could qualify for a subsidy for marketplace insurance only if the cost of their employer-based coverage was considered unaffordable based on the threshold set each year by the IRS, but the determinations took into account only how much workers would pay for insurance for themselves. The cost of adding family member to the plan was not part of the calculation, and family coverage is often far more expensive than employee-only coverage. The families of employees who fall into the glitch either go uninsured or pay more through their jobs for coverage than they might if they were able to get an ACA subsidy. Now the rules say eligibility for the subsidy must also consider the cost of family coverage. For the first time, a lot of families will have a real choice between an offer of employer-sponsored coverage and marketplace plan with subsidies, says Sabrina Charlotte, a researcher and co-director at Georgetown University Center on Health Insurance Reforms. Workers will now be able to get marketplace subsidies if their share of the premium for their job-based coverage exceeds 9.12% of their expected 2023 income. Health quality goes down on families who don't qualify for ACA subsidies. For some uninsured, simply signing up is a challenge. Thanks to the change in the rules, two calculations now will occur: the cost of the employee-only coverage as a percentage of the worker's income and the cost of adding family members. In some cases, the worker may decide to remain in the employee plan because his or her payment towards coverage falls below the affordability threshold, but the family members will be able to get a subsidized ACA plan. Previous legislative effort to resolve the family glitch failed, and the Biden administration use of regulations to fix it controversial. The move may ultimately be challenged in court. Still, the rules are in place for 2023, and experts, including Colette, say family who could benefit should go ahead and enroll. It will take a while for all that to get resolved, she says, adding that it's unlikely that there would be any decisions in time to affect policies for 2023. An Urban Institute analysis published last year estimated that the net savings per family from this change in regulation might be about $400 per person, and the cost to the federal government for new subsidies could be $2.6 billion a year. Not every family would save money by making the change, so experts say people should weigh the benefits and potential costs. Preventive care will still be covered everywhere without a copay, but abortions coverage will vary. Many people with insurance are happy when they go in for a cancer screening on the or seek other preventive care and find they don't have to pay anything. That comes from a proficiency in the ACA departs cost-sharing for a range of preventive services, including certain tests, vaccines, and drugs. But a September ruling by U.S. District Judge Brett O'Connor in Texas led to confusions about what might be included and the category next year. The judge declared unconstitutional one method the government uses to determine some of the preventive treatments that are covered without patients' cost sharing. Ultimately, that may mean parties will have to start paying a share of the cost of cancer screening or pay part of the cost of drugs that prevent the transmission of HIV. The judge has yet to rule on many people on the case will affect, but for now, the ruling applies only for employers and individuals who brought the lawsuit. So The time is up and the article will be continued to read on the next video. So bye bye and don't forget to like, comment and subscribe. Bye.